Welcome to Medicate. Today we're going to look at antacid drugs. For antacids, there are types, indications, actions, adverse reactions, and contraindications. We will start with the types. Here are the types and examples of antacid drugs: aluminum hydroxide, calcium carbonate, magnesium hydroxide, magnesium oxide, and sodium bicarbonate. Next, we will look at the indications of antacid drugs: gastric, hyperacidity, hyperphosphatemia, especially aluminum hydroxide, hypomagnesemia, especially magnesium oxide, and postmenopausal hypocalcemia, especially calcium bicarbonate. Here we will also look at the actions of antacid drugs. Antacids reduce the total acid load in the gastrointestinal tract and elevate gastric pH to reduce pepsin activity. They strengthen the gastric mucosal barrier and increase esophageal sphincter tone. Aluminum-containing antacids bind with phosphate ions in the intestine to form insoluble aluminum phosphate, which is excreted in feces. Calcium helps to prevent or to treat negative calcium balance and bone loss in osteoporosis. Next, we will look at the adverse reactions or the side effects of antacid drugs. For aluminum antacids, there will occur a side effect of aluminum intoxication, constipation, hypophosphatemia, intestinal obstruction, or osteomalacia. For magnesium antacids, diarrhea is likely to occur, hypermagnesemia, especially in the case of renal failure. For calcium carbonate, magnesium oxide, and sodium bicarbonate, constipation is likely to occur, milk alkali syndrome, and also rebound hyperacidity. Next, we will look at the contraindications. These are situations or occasions in which the drug should be used carefully. For carbonates, calcium carbonate and magnesium oxide drugs, they are contraindicated in severe renal disease. For sodium bicarbonate, it should be avoided in hypertension, in renal disease, in edema, in vomiting, also in those on diuretics and GI suction, as well as sodium restricted diets. For magnesium oxide, it should be used cautiously in mild renal impairment. Aluminum preparations and calcium carbonate should be used cautiously in the elderly and also for those on antidiarrheals, also for those on antispasmodics, anticholinergics, dehydration, renal disease, and those with absorptive issues or absorption issues. For pregnant or breastfeeding women, there should consult the prescriber very well before using the drugs. For infants, it should be monitored for fluid or electrolyte imbalance. In the elderly, there is an increased risk of adverse reactions, and therefore the prescriber should take note of that. Thank you so much for sticking to the end of this video. I really appreciate your time. Please take a moment, subscribe, comment, and share this video with the relevant viewers. Thank you. Thank you. Until we meet in the next video.